I've really, over the last couple of years, really enjoyed working with Congressman Kelly and her staff in putting together this meeting. And as you know, yesterday she was caught in the O'Hare mixer, or whatever they do in O'Hare airport. And I'm pleased to say she's joined us this morning, and she'll come and bring greetings. Thank you.
Good morning, everybody, and welcome to day 2 of the 16th Annual National Minority Equality Forum and Congressional Black Caucus Spring Health Braintrust. Every year, I think this summit just gets better and better, which only means that our work, thank you. That our work as legislators, as healthcare providers, as advocates, and as industry leaders becomes more and more critical to the health of people of color and that of the entire nation. I want to again convey a huge thank you to my friend Dr. Gary Puckrein and the National Minority Equality Forum staff for all of their visionary work in putting together this summit. And of course, I am always grateful to my own staff under the Congressional Black Caucus Health Braintrust. As chair of the Braintrust, I want to focus my remarks on the present state of healthcare and on how we all have a collective responsibility to move the health of our nation toward equity by making healthcare more accessible, more affordable, more expansive, and particularly more diverse in terms of our network and workforce of healthcare professionals like each of you. These are significant times, ladies and gentlemen. We are living in times of rising healthcare prices across the country, in no small part to the attempts of the Republican Party to dismantle the healthcare access expansive tenets, including the individual mandate and the most recent attempt in Texas to do away with the ACA in its entirety. We are living in an era of high stress impact as the effects of racism biologically after the well-being of Black and brown bodies. For example, we see the role of this stress manifesting in high rates of maternal mortality and morbidity of Black women compared to white women, which we talked about yesterday, which is why I have reintroduced my bill, H.R. 1897, the Mama Act. And we see similar effects of the stress associated with chronic racism in the rapid cellular aging of Black men compared to white men. We are living in a time of chronic disease persistence where hypertension, cancer, and diabetes bear great cost, not only to the health of our families, but also on our health system. We are also living in the age of precision medicine as we witness the rise of technology and innovation in healthcare. As the nation moves from a majority white demographic to what Dr. Puckrein refers to as the new majority of Black and brown people, our healthcare needs are more unique and complex than ever before. Being able to harness these developments will essentially make the difference between whether or not people of color can benefit from life-saving interventions or whether we will be left behind. If you were here yesterday, you heard from illustrious panelists all about these phenomena. We are looking forward to unpacking these and other significant issues to an even greater extent today. Again, these are significant times. I've spent the last few years in Congress holding the line to preserve the progress of the Affordable Care Act. Now is the time for significant gains. I want more people to have health care. I want more people to live healthy lives. I want more doctors, nurses, dentists, scientific researchers, C-suite executives, and medical professionals who look like you and me to be able to do their jobs to the best of their abilities. Diversifying the healthcare workforce, that is the core mission of our gathering over these 2 days. As you meet more leaders across the healthcare system throughout the day, I urge you to identify ways to form collaboratives, to focus on advancing health policy, healthcare delivery, finance, and business, and global and local advocacy level strategies to build a more diverse healthcare network. We have a lot of work to do. Hopefully, you'll get some new ideas here, or your ideas will be implemented somewhere else. And again, thank you for coming. We really appreciate it. And with that, I'd like to introduce my friend, Dr. Niva Lubin-Johnson, the president of the National Medical Association. Niva.
Good morning, everyone. It's a pleasure to be here this morning. Thank you, Dr. Puckrein, for allowing me this honor to give welcome remarks this morning on behalf of the National Medical Association. For those who don't know, NMA was founded in 1895 in Atlanta, Georgia. Yes, that means we'll be 125 years old next year. We were founded, thank you. We were founded because we couldn't join the AMA, and that didn't occur until about the 1950s or 60s. But I'd like to say I'm also now an AMA member too and after June, I'll hold probably 2 leadership positions in that organization also. So we're here to talk about diversity and the importance of diversity. Diversity is one of the 5 health policy foci for this year for the National Medical Association, along with physician sustainability, or what I like to call resiliency, decreasing gun violence and the prevention of gun violence, also expanding access to care with expansion of either Medicaid or betterment of the ACA, and finally, being in support of Congressman Kelly's legislation, the Mama's Act, is part of our 5th goal, which is decreasing maternal mortality of African American women. And so you see the synergies continue. So I look forward to being here today, being on a panel later with a couple of my fellow female leaders in medicine. Yes, women do rock. And participating on that panel, and look forward to a day of learning more, as Congressman Kelly said, hearing your ideas or hearing other ideas today. So thank you once again.